Good afternoon. It's Friday, which means it's time for Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, and also at some point during the week you're also able to see this program on CTV3 in Connorsville. Thanks to John and his staff for making this information possible. As always, we have with us the doctors. I'll start this side this week. I think I'm going back and forth. Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health, and turning this way, Dr. David Jetmore, Wayne County Health Officer. Gentlemen, how are you today?
Great. We're fine. How are you, Eric?
I'm doing fine,
ready for another hour of fascinating questions and answers?
I am. Do you have answers?
I was hoping for more multiple choice and true and false questions this week rather than the essay type.
You came to the wrong place. Sorry about that. As we normally do, we're going to start this by giving you both a chance, as this has gone through another week, just to talk about what you're seeing, what you're feeling, what you're hearing. And Dr. Huth, we'll start with you.
Well, I think for me, maybe the two biggest pieces of news this week on the treatment side is that there was a lot of publication or publicity around the release of information from a study that was actually closed early in England that was using dexamethasone, which is a corticosteroid drug, in treating very sick patients on ventilators, and they feel that they were reducing death by 30%, which is quite a big number actually. And that's really good news when we have a virus for which we don't have any specific treatments, and the treatment is basically supportive. Now, I think that there's always caveats to these things, and the caveat here is that this has not been published in peer-reviewed literature yet. We're waiting for that to come out, so there'll be lots of people sort of picking away at the numbers and the details, and maybe it won't quite live up to all the hype, but we're hopeful that it will, and I'm quite certain that at this point care teams all over the country are looking at how to incorporate dexamethasone into their treatment protocols. I know that we're doing that at Reed. Showing much more promise than, hydroxychloroquine seemed to do and so forth, which that's a drug that got a lot more publicity. Then the other thing that has been in the popular media is that over the last week or so, especially the last few days, there does seem to be a growing momentum of increasing cases across the U.S. Mm-hmm. And I think there were 20 or so states that have an upswing in cases. One of those, I think, was Florida, actually has what looks like what we would have expected with a second wave. And so there's a lot of speculation about what's behind that, but I think we can talk more about that, but I think there are a couple of possible answers other than just the fact that it's all due to reopening. That may be a factor, but there may be other factors as well.
Okay. Dr. Jetmore, you've had a busy week, haven't you?
Yes, I have. People are concerned about the kids going back to school in the fall, so there's been a lot of questions to answer about that. From a public health standpoint, as Tom said, cases are growing in Florida and in 22 other states. I think it's 22 or 23 states where coronavirus cases are increasing, COVID-19. Indiana has fared better than most other states, and the State Board of Health conducted the second part of their plan to see how much COVID-19 is in the Hoosier population. As you remember, they did a initial study back in April, and now they've completed the second one the first week of June. Each one of these was to have 5,000 people, and the people were invited by the Board of Health to take these tests. They were antibody tests and an actual test for the virus to see if you were infected at the time you were brought in. The first study showed that 1.7% of the people who appeared had COVID-19. And the second study, the one in the first week of June, only 0.6% of people who were brought in, and again, these are randomly chosen people, mm-hmm. had COVID-19. The antibody studies in the first study were 1.1%. This time they were 1.5%. So a slight increase in the number of people who have had COVID-19. So that's a good thing. It seems like about 3% of the population in Indiana has had COVID-19, and most people quote a number of 5% of people in the United States have had COVID-19. So that being said, we are now close to releasing all of the restrictions that the governor put on our citizens back in March in order to quell this epidemic. And we're lifting those restrictions for economic reasons, not because we're free of coronavirus, because we still have the COVID-19 circulating in our society. Other than the fact that 5% of people have had the virus, nothing has changed from the lockdown back in March. So I want to take a little bit of time to tell everyone who's watching that this is not the time to let your guard down. This is the time to go out and have fun, do the things that you have been missing, but wear a mask and try to social distance yourself from other people. This is what's going to keep the virus from spreading. We have very little treatment, as Dr. Hughes said, other than supportive care. There's no vaccine yet. So this is the main tool we have to prevent the spread of COVID-19.
And that came up in yesterday's health board meeting. You all were talking with some of the school superintendents. You mentioned people are wondering about school. So we reached out to one of our superintendents, George Philhauer, who is the superintendent of Western Wayne Schools. I think he can hear me. We can see him on the screen. George, how are you today? Okay.
Can you hear me?
We are getting better at hearing you. Yes, our tech is working on it, and we're almost there. How has your, I don't want to say summer because it's kind of just getting started, but talk a little bit about how this whole thing, from the time you've had to do the shutdown to getting through graduation, getting kids out, how has that all worked around you and your staff?
So we've just taken it one step at a time at Western Wayne. In March, it seems like yesterday, and it also seems like 3 years ago, all at the same time, that we were at the Wayne County Health Department and discussing closing down school the 2 weeks after we got back from spring break. And then by that next morning, the announcement had been made that we would not be going back to school the following Monday, and we haven't been back since. So we went from trying to figure out what school might look like for the rest of the year, and as difficult as that was, being that we weren't really prepared to launch into at-home learning for the last couple months of school. And then, as you mentioned, all kinds of things like graduation, and we're still trying to figure that out at Western Wayne. We did a virtual graduation, but do have an in-person event planned for the late part of July. And as everyone knows, we're trying to figure out what school's going to look like in the fall as well.
We've been getting questions on this show for a number of weeks now, with them asking the doctors what they think school's going to look like, trying to figure out whether the school boards and superintendents were having discussions about this at all. Can you talk about what the discussions with your board has been like, what the type of issues are that you all are even thinking about, knowing that you haven't made final decisions yet, but just kind of let us know where the conversation is?
Initially the governor announced that we wouldn't really be getting guidelines until the first week of July for going back to school. But then we did get a memo that was sent to us just a couple weeks ago. And up until that point, there really wasn't much for us to be able to talk about other than, what we hoped and, just based on what we were seeing in the news, just like everybody else. And then when we got the guidelines from the Department of Education, they referred to the the previous guidelines that have been put out by the CDC, and also directed us to work with the local health departments. So with the Wayne County Health Department in our case. So for us, we've just been in a process of information gathering. We've met with our administration team several times at Western Wayne, and other districts are doing the same. We've sent out surveys to our families to find out, what are they worried about, and what do they want us to make sure that we're thinking about. We sent surveys also to our staff members to collect the same kind of information. And then we've also met with the Wayne County Health Department 2 times, and then we were on the conference call yesterday as well. Just trying to put together as much information as possible so that we can put together a good plan to bring everybody back safely. Our biggest challenge is that nobody was trained for a pandemic, like this, but educators certainly weren't, and we know the ins and outs of the details of what school looks like, but in terms of health and that type of safety, we definitely are relying on the medical experts to help us figure out what that looks like.
I'm going to ask one more, and then I'll turn it over to the doctors to see if they want to have the conversation. I'm curious, in your surveys with your parents as well as your surveys with your educators, are you finding the concerns to be about the same, or are you finding the concerns different from different sides, and even whether you're looking at someone with an elementary school student versus someone with a high school student? Are there similar concerns, or are the concerns pretty broad depending on the audience?
I think the concerns are predictable, and as unfortunately, this isn't the kind of survey that we take and we look at what the majority wants and we go with that. This is, because when you're talking about health and safety, we need to make sure that everybody feels safe returning to school, because the truth is you don't learn very much if you don't feel safe. We've got polar opposites. This is a polarizing topic, and unfortunately it's entangled with political discussions and all kinds of things like that. We have on one hand families who are adamant that students need to wear masks, and I don't know that I feel safe unless everybody's wearing a mask. And then on the other end of that, we've got I'm not interested in coming back to school if we're being forced to wear a mask. And I think that pretty well is represented just from discussions with my colleagues in the other districts in the county. That's pretty represented throughout our county.
Gentlemen, open it up, see if there's anything you want to.
George, you mentioned that meeting back in March with public health. That seems like 100 years ago, and we talked about maybe keeping the kids out of school an extra week in spring break, and then the governor's mandate came down, and this tsunami swept over us. I have to say, I think it's tough to educate children in normal times, and I so much admire the teachers, but asking them to teach children in the middle of a pandemic seems almost impossible, but it's something that we have to do. It's important, and I think the only tools we have are masks and social distancing. I think the social distancing, there's going to have to be trade-offs. I think it's going to be difficult dealing with these kids, probably more so depending on their age group. But I think masks for the teachers and the students are critical to mitigate the threat of the virus. I also think it's especially important for the teachers, the school nurse, the custodians, all the adults. Actually, the adults are more at risk than the children are. So we want our educators to be safe during this time.
Yeah, I It seems to me that the challenge is a tough one because on the one hand, children don't tend to get very sick with it. There are some exceptions to that. We don't want to totally minimize the risk to children, but children they can get COVID-19, but they don't get tremendously ill with it typically, and we are concerned about their ability to transmit it to others. But it looks like, from the evidence that's available so far, that they're less likely to transmit to others than adults are, but that's not a complete either. So it's sort of a muddy picture for me. But I think when we look at the three pillars, to me, are masking, distancing, and hygiene, surface hygiene, hand hygiene, and how do you achieve that in a school setting? I'm wondering, Superintendent Philauer, whether you are thinking about any potential ways to address those issues beyond just the masking question. For instance, I've wondered, now with this experience of having tried to do some remote education via electronic means, is that something that you see continuing in the fall to some extent in your future?
Yeah. First of all, I definitely agree with both of you that this is a big challenge. In education, it kind of goes against everything we're being trained to do. We know that the learning is social. And so a lot of our best practices involve sitting kids close to each other so that they can learn from each other, and the same with teacher, learning, the best learning happens best in circles versus rows. But those small group circles aren't going to be as possible in the fall. So we're looking at all of the best practices that have been asked of us, that setting up our classrooms with kids facing the same direction, trying to put as much space between those desks as possible. Depending on space available, I think that's going to be more possible in some places than others, depending on class size. I'm confident, especially in the primary grades at Western Wayne Elementary, that we can get those, we can get the physical desks 6 feet apart without really doing much change. Our class sizes are pretty small. The challenge is trying to socialize or social distance a 5 or 6 year old is not an easy task. When you've got 15 or 16 of them in the room, and that is definitely a challenge. And our admin team, and I know the same is true in all the other districts, meet routinely, and that includes those who are responsible for making sure that everything's clean. And the challenge with that is that it's going to require all of us to pitch in and clean surfaces and make sure that those kinds of things are done, because the typical school building is staffed by one custodial staff during the school day, and it's not possible to do all the cleaning we need to do with just that one staff member in all of our schools. So it's definitely going to be a team effort to make that happen. The biggest challenge is that it feels sometimes like our choice is either go back to school the way it was and make learning happen the best that it possibly could, or do nothing at all. And really, that's not really our choice. Our choice is going to allow us to make some decisions that land us somewhere in the middle, and that middle is going to be better than no school at all. And I think we can still make great things happen in those parameters. And in terms of virtual education, I think all of us are planning to continue to offer a choice to continue to learn remotely from home if families choose. Our early indicators from our surveys, that's not going to be a popular decision, at least at Western Wayne schools. We do have some families indicating that. The other thing that we're thinking about, and I'd be interested actually in the thoughts from the doctors in the room, is, I think one of the things that was really hard in March is that we were not prepared. And what we have the opportunity now is to be prepared. So I think as I'm creating and working with my team and my board to plan for our plan for the fall, I think flexibility has to be key, that we need to be prepared to there could be the likelihood, as you mentioned, things are spreading in other states, and if that happens in Indiana, and in October when flu season picks back up, if we get sent home again, I think we just need to be more prepared for that. So I think flexibility is going to be key for all of us as we think about the year.
Yeah, I mean, you asked for opinions, and so I'm always ready with an opinion. So I guess I need to caveat that with, I'm not the authority on any of this, especially when it comes to the public health aspects. And so what I'm about to say, I'd love to hear Dr. Jetmar's feedback on that. But to me, if I could construct the perfect world, I would have the kids in school sooner than what you would normally start school, because what I'd like to see them is get a term in before we get into the flu season. If, as some people believe, that COVID may be somewhat of a become some of a seasonal virus, like many coronaviruses are, and it gets combined with even a mild flu season, that could really stress all the systems, the health system, the school systems. And I think probably the worst thing from the school standpoint would be to, start school in August or September, whenever the schools start, and then have to close down schools because of outbreaks, or close down the whole district because the state's in a big outbreak after just a month or two. And so I'd rather see the kids get into school now when we think that the virus is going to have less of a chance of a survival with the temperatures and the humidity and ultraviolet radiation from the sun and that sort of thing before flu season comes. That would be one tip that I would do, and I'm sure it's very easy for me to ask that, but very hard to put into place. But the other thing I would do is go almost person by person, student by student, and staff by staff, and assess their risks, and come up with action plans for those who are at high risk. How are we going to get them, the children who are at higher risk, how are we going to get them the services that they need, the education that they need, have an educational plan that's for them. And the same thing for staff. How can we modify staff's activities and roles depending on their own risk profile? So if you have older staff with underlying chronic medical conditions, maybe they need to have some sort of adjustment made to protect them. And again, something very easy for me to say, but very hard to put into place. But those would probably be starting points if I were a superintendent.
I think a lot of this comes down to managing risk. I mean, the whole idea of sending these children to school in the middle of a pandemic is the fact that, we've made the decision as a society that it's of greater risk that these children not have any learning or the teaching available to them for an extended period of time. So I think there's no way that the social distancing in this kind of an environment can be done at 100%. You're not going to keep everybody apart 6 feet all the time. And I realize that, and I think the teachers realize it as well. But you try to minimize those things. There are things you can do by the children moving through the school. You have them moving maybe one side of the corridor and returning on the other so that they're not spending a lot of time together. You try to not have situations where the children are grouping around. For instance, I wouldn't take temperatures in the morning. I'd have the children or their parents fill out a questionnaire that might list the common symptoms of COVID-19. Of course, one of the most important things is not to send a child who's sick to school. But each one of these decisions is weighing one risk against another. Sports, for instance. I mean, you weigh the risk of a team playing soccer outside versus the obvious benefits of being on a team and having sports in your life, the socialization of sports. So there are many decisions to be made, many that I haven't thought of at present. I'm sure the educators have wrestled with these questions. And, the health department and myself and my executive director are going to be there to advise them and answer questions that they might have. But it'll be an interesting experience. This is a once in a lifetime happening. None of us.
Hope.
I hope so. None of us were prepared for this, and we'll have to see how it goes.
We're talking with George Philhauer, Superintendent of Western Wayne Schools, on Ask the Doctors. Before we let you go, have you been able to, a question that we got that we can't bring up on the screen, have you been able to map out at this point any possible scenarios of what things might look like for you, or are you still in that formulating stage, having just gotten through the 38-page guidelines from the state plus the health department's conversation yesterday?
So a little bit of both. So the answer would be yes. In my mind, I've played out probably every situation you could ever think about, and put them on paper and drafted and redrafted. But we're really taking it's going to be a team effort to put a really good plan together, because I know I'm not able to think of all of those different scenarios that Dr. Jetmore was just talking about. But I'm confident. I'm meeting with a larger group of my team this next week, and I'm going to continue to expand that team so that we can put together a plan. The more heads we have at the table, the more scenarios and problems that we're going to think about. We always say our job is to always be looking to make things better. The way you make things better is you find problems and you fix those problems. And it's going to take a little while for us to think through every potential scenario and try to solve as many of those issues as we can prior to getting kids in the building. And then also knowing that once we get the kids in the building, there's going to be things that come up that we're going to have to problem solve around as well. And there's just so many different factors. If you think about everything that's involved in getting a kid to school and all the way to getting them home, they're eating at least one meal, likely two while they're there. And there's lots of different things that we're all going to have to think about.
As you're looking at this, and we'll let you go on this, you've got probably less than 6 weeks, I would say, to make this work, because school starts in that time frame. Is there a drop-dead point at which you just have to go, this is the best we're going to come up with, and we'll have to work on the fly? Is that mid-July? Is that 2 weeks from now? At what point do you need to be able to tell coaches what's going to happen with sports, parents what's going to happen with classes, deal with buses? Where are you in that?
So it'll probably be more of a stream of communication that comes from Western Wayne, that sports is gearing based on the IHSA guidelines to start back up here in July with a staggered approach to that. So we'll have some communication that comes out about that really soon. In the next couple of weeks, we'll have some pretty general information that comes out about, these are the things we're thinking about right now. And then as we get closer to the school year, those things will get more specific. At Western Wayne, we're in the process now of contacting all of our families that we haven't heard from on the survey, just to figure out, what are they thinking? We also know that once we have a plan put together, that's probably not a final plan. It'll likely change once the school year starts and things continue to evolve. We said from the beginning, and I'm kind of tired of hearing it, but it's true, is that this is a very fluid situation, and I'm guessing every week on your show there's probably new information to present, and as that new information is learned, it's our job to adjust and do the best we can to make sure we can get back to school as safe as possible.
In a couple of weeks, you're going to be the second longest tenured superintendent of Wayne County Public Schools. Does that scare you a little bit? I've
got some really great colleagues that I love to work with, and I've known Dr. Barentine at Nettle Creek for a long time, and the other two at Northeastern and Centerville, they're not new, and I've been working with them for a while, so we're not going to let them off the hook too easily. It's saying that they're new, um, you know. So I'm just excited to continue to work with them, and we definitely lean on each other quite a bit.
We appreciate your time, and hopefully we'll talk to you again as things get closer and you can lay out a little more straightforward information for us.
Yep.
We appreciate
Thank you all.
it.
Yep. Thanks for having me on.
Thank you. George Philhauer, Superintendent, Western Wayne Schools, appreciate the time today. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Also streaming on Facebook Live, also on WCTV Channel 21. The show is Ask the Doctors. I think we've probably gotten some questions in, so let's try to get a couple of those in because I know we're over halfway through the show already. Are there any newer updates as people have started mixing, whether our teens are getting sick anymore now versus in March when we shut down? Now are they beginning to go out more? Now they are beginning to go out more. I wonder if there's any changes. Or what are we seeing in the population, particularly in teens? Because I'm sure it's probably harder to get teens to follow the social distancing and masking rules than anything else. So what are we seeing in numbers in that way?
Well, if you're talking about the United States, I think we are seeing an increase in many states. And I think this has come after mitigation has been lifted. The governor of California has talked about having everybody wear masks if they're in a public place. As far as Indiana goes, we've kind of reached a plateau. I know Tom kind of leads a meeting every week on Tuesdays and Thursdays that involves hospital staff and health officers from surrounding counties, and it looked like there was just kind of a gradual descent on the backside of that curve, but now it's starting to plateau a little bit, and I worry that this might be the effect of lessening the mitigations we've had earlier. I'm sure Tom has something to add to these comments.
Well, with specifically the question being about teens, I'm not really aware of any dramatic changes in the positive rates amongst teens, but I can't say it's not happening. So that's a really good idea to go back and kind of do a little bit more research on. How have the positive rates changed by age group? And we have the state website kind of breaks that down, but it doesn't give you much information about what happens over time. Mm-hmm. But that's something we can maybe look into. But I think that's a good thought that, I said before that young children, the younger they are, the less likely are to get really sick, and we don't think that they have much of they're not much of a vector in the transmission of disease to others. But as you age, when you get into this teenage and early adulthood years, the story is probably completely different. And so we do have to be concerned about that. So that's a good thought. I don't have a good answer to that, but that's something to research.
Okay. Next question. I know we're backed up by a few. I'm in a high-risk group. I have an N95 mask that I wear to the grocery store. I go every other week. Can I keep reusing that mask if it airs out in between store runs? It's the only one that I have.
I think the answer is yes. Dave can maybe have a different opinion, obviously, but I think the guidance from the CDC generally on N95s is, when we're using them in the healthcare environment, is to take particular care about how we're using them, avoid contamination, and to discard them at least when they appear to have physical soiling or become damp from the humidity of breathing and so forth. But as long as it's clean and dry, and it is airing out for significant periods of time in between use, it should be fine to use as long as it looks to be intact and clean. We do have the ability to sterilized N95s for reuse. We've not actually reused them at Reed because we haven't had to because of our supply. We prefer to use new when we have those available, but there are protocols for sterilizing them, and we are actually sterilizing some of ours, and they're just going into storage at this point. But I think the person who asked the question asks a very good question. How long can you use a mask? And really it just depends on how long it remains clean and dry.
Well, I want to congratulate the person
Yeah.
asking the question for wearing a mask.
Right.
Good for you. And I agree totally with Tom. I think as long as the mask looks physically clean, I would continue to wear it. N95 is a great mask.
Next up. Is there anyone other than the governor who can mandate that employees of a retail establishment wear masks and be responsible for social distancing?
Well, the local health authorities can make decrees or laws, or not laws. We can ask people to do things that are more strict than what the governor mandates, but not more liberal. So we could do that. There's been resistance to do that from local government, of asking people to, instead of mandating that, asking people to be prudent and wear a mask. Certainly clerks in stores and restaurants should wear a mask. Beauty operators, they have to wear a mask. They've been specifically told by the governor that they have to wear a mask. So we've tried to ask people to be prudent, look out for their neighbors. We're all in this together, and wear a mask. If situation right now, we're doing very well in Indiana, but if situations deteriorate, that's something that will come into play.
I think my observation is that, I mean, you said that you could mandate things, but typically you've tried to take more of a educational, encouraging approach when we want people to, and when you want people in the community to do certain things. And that when it comes to actually mandating things, typically work through the elected officials who kind of have the statutory authority to give executive orders and that kind of thing, which has been done. But I think I would commend Dr. Jet Moore and Christine Stinson, his health department director, that they really try to take kind of a partnering, collaborative approach to reason with people about how to behave. And honestly, I think it's been reasonably effective. Obviously, we can't get 100% compliance with that, but I'm impressed with how often when I go to retail establishments, the employees are masking. But I think, from my standpoint, I'm not as interested in what they're being mandated to do. I'm more about, why don't I assess my own safety and health in certain situations? And if I'm not comfortable with how somebody's running their retail establishment, then I don't go in there. I leave. So I think that is probably, if more people did that, the folks who are responsible for those establishments would probably actually sit up and take a little bit more notice than if they're getting mandates and letters and counseling from the local public health authorities. I think that can have an impact if I alter my behavior in response to the environment that the retail operators are creating.
Yeah, I think people can wear a mask for two reasons. They can wear a mask because they've been told to, they've been mandated to do it. But I'd rather have them wear a mask because they think, you know what, this is really a good thing that I'm doing. I'm protecting my fellow citizens from my aerosol, from my breath. I might be an asymptomatic positive patient, and I'm making their environment safer.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We've got a few more questions we're going to try to get in, so let's keep going. We are finally in the summer months. So what are your thoughts on people traveling south to beach areas on vacations? All right, who's the travel consultant here?
I think that this is something that can be done safely. I assume that you're wanting to go to a beach somewhere. I think the less crowded the beach, the better. I mean, you can mark out your spot on the beach with a blanket. You can go in the water and distance yourself from other people. Being outdoors is one of the safest places that you can be in terms of protection from COVID-19. So I say go for it.
What are some things that people should be doing? When you go on vacation, you're not living in your house. You're someplace else, whether it is a hotel or a B&B. You're eating at various places, buffets, sit-downs. Are there some, for those people who care, and for some people it's just, okay, I gotta go. For some people who care, who want to have some idea as to how to protect themselves, and they're going to travel, is there anything that comes to mind from a public health standpoint that you would suggest?
Well, I would have everybody take a mask with them. There are going to be places where they're going to go in. I would, the gas pump on you're going to be using a lot of gas if you drive to Florida or to the Carolinas. Get a vinyl glove to protect yourself from the gas pump handle. You're going to go in, maybe you need some supplies on the vacation, you're going to go in a store. Put a mask on. It's a simple thing to do. It'll give you some peace of mind. Take some hand sanitizer with you and keep your hands clean. But I think one of the, when I hear people are doing something outside, I always feel better about it because the risk never diminishes, but it certainly goes down very quickly as opposed to people being indoors in a crowded situation.
Anything you want to add?
Yeah, I was kind of asked this question on WHIO a couple weeks ago, and my advice is just pretty much exactly what Dr. Jetmore said. There's no reason not to go enjoy yourself on vacation, but you have to be smart about it and take into account how a plan, have a pre-plan for how we're going to deal with what I consider to be the three stool legs of how to protect myself. There's, be ready to mask when I have to be close to people, try to maintain distance, and and pay attention to hygiene. And in particular, I think on vacation, it's a version of what I referred to a couple minutes ago about how I need to be looking at the situations I'm going into and try to avoid retail establishments and other situations where the hygiene is not being attended to in the way that I would prefer. So I think as long as I take those steps to protect myself and my family, it all should be fine.
Okay. Let's keep going. Next question. Can the MD share details about contact tracing methods?
Well, when we hear of somebody that's tested positive for COVID-19, or maybe they have a clinical diagnosis, they've got a fever, they've got a headache, they've got a cough, they've lost their sense of smell, and we presume that the person probably has COVID-19. Then becomes the process of contact tracing, which is kind of a staple of public health and has been for decades. Because we know who the patient is, we find out where they live, and we find out their contacts. And a contact is somebody that the person who has COVID has had close contact with for at least 15 minutes. If you pass somebody in a hallway and you have COVID, their chances of getting infected are very low. We have questionnaires. One of the things we ask is where do you do your shopping? What drugstore do you use? What gas station do you use? And we're looking for patterns here a lot of times if we have several people. If we think that there is, then if we can establish, and a lot of this is done over the telephone, that there have been contacts, then we call those people up, ask if they've been feeling ill. If we think it's been a close contact, we may ask those people to be tested. If they're positive, then they confine themselves for 14 days. But that's basically how this is done.
Did that come up in conversation at all as you all were talking with the superintendents yesterday, in that you remember in the conversation about where kids may be, whether they're riding on a bus, whether they're sitting in a classroom?
It did come up. I think one of the things that's important in the school situation is knowing where the children are. In other words, if they're riding on the bus, it would be good if they sat in the same seat every time. And the children, when they get on the bus, should go to the back of the bus. That way you don't have kids passing through the aisle. You'll fill it up from the back to the back, and then you'll empty it from the front. But one of the things that happens there is if a child does become ill, we can look at where the position they were on the bus. The same way with the school, they should have an assigned seat. If it's an art class where they're around a big table, they should be sitting at the same place at that table. And that gives us an opportunity to do contact tracing, because we will have some clues from the very beginning on what close contacts this child might have had.
I haven't had a chance to watch it, but just as a shameless plug, if you're watching live on this Friday afternoon, yesterday's health board meeting actually will immediately follow this program. So if you want to hear some of that conversation between the Wayne County Health Board and the superintendents, stick around at 3 o'clock, WGTV Channel 11. That will also be available a little bit later on today on WGTV Online, our video on demand site. So you will have a chance to actually view that meeting. Anything you want to add about contact tracing, or should we move on?
Well, that's in Dr. Jetmore's domain, and I think, but I would mention that I have noticed this question comes up frequently, and I'm not sure if people have fears about it or whatever, but I want to reiterate that that is a standard public health measure. It's been done for not just decades, for 100 years. And it's very important, especially in the earlier phases of an epidemic or a pandemic, to try to understand who may have been exposed, and trying to contain local outbreaks. So people don't need to fear it, basically. I think maybe the public health folks sometimes get a little resistance from folks to kind of provide information, but we need to encourage people to cooperate fully. That way we can get our arms around things, contain things better.
Okay. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We are taking your questions. If you have a question, there's still a little bit of time. We're probably under 15 minutes left to go in the show, under 10. The voice in my head says. Facebook Live, or you can send a tweet to @WCTV Info, so we'll try to get one or two more in before we run out of time. Has any cases of the pediatric multi-symptom inflammation syndrome been seen in Indiana? I think you've talked about this a little bit over the last couple of weeks, and how has the vaccination program been affected by the pandemic? And we've talked a little bit about vaccinations, but it's always good to, everybody doesn't see every week's show, so I'll let you two kind of talk about that. We'll start with the child inflammation syndrome.
Well, the pediatric multi-system inflammatory syndrome is a concern. I think what we need to realize about that is that we don't know for sure that it actually is a COVID-19 complication. That's a thought, but I think it's going to be a while before we know whether that's the case. It looks very much like a condition called Kawasaki disease, which is a rare, but something that does happen from time to time. Whether it's related to COVID-19 or not, in this case, is still to be determined. There is also a potential version of that happens in young adults that's been described. But I think that the number of cases of this in the U.S. is pretty small, And I'm not aware of any in Indiana. That doesn't mean there haven't been any, but I don't know of any. And so that's how rare it really is. So that's a stay tuned issue. On the vaccinations, we definitely have a concern about vaccinations. They've been down quite a bit, and we're encouraging that at Reed. We're going to have more of a push on people making sure that they get their own adult vaccinations, but also especially the childhood vaccinations are very key. And I know that the health department is working on some plans around that too.
Yeah, I think Christine Stinson, our executive director, told me the other day that overall in the state, the vaccinations were down an alarming 80 to 90%. And vaccination is so important. Of course, that's a pillar of public health, preventing these diseases that are easily preventable. So we're wanting to get people caught up with vaccinations. We're hoping that we may get a mobile unit that will allow us to visit some of the outlying communities in the county and give vaccinations locally. But we need to get the children caught up in their vaccinations. This is as big a threat to their health as COVID-19, so we don't want to lose track of that.
We've probably got about 6 minutes left to go. I know that one of the things people, I don't want to say enjoy, but really want to know is where the hospital is. You've done updates for us every week before we get out of here this week, because it looked like there was a slight uptick in ventilator use or something.
Let's look at that. This is now I hope the familiar bar graph that I prepare every day, and just as a reminder, each set of bars is the average over that week, over the week in question, and the last bar is this week so far, the average daily rates of all patients in isolation areas. Laboratory positive cases is the middle bar, and then the one on the bar on the right of each grouping is the patients on ventilator. And it does look like we have an uptick in ventilator patients. I have mentioned before that we would expect the blue bar to be coming down, to be lower on account of maybe some changes in our policy on moving patients out of isolation under some conditions that we hadn't done a month ago. So that bar is maybe less helpful for determining where we are in the stage of things. But more important is the severity, and that's really kind of where the ventilator cases comes into this. So far this week we have an average of 4 patients a day on ventilators in the COVID ICU. There is another part of the ICU where there are 1 or 2 other ventilator patients for other reasons. And so this is a concern right now that we may be seeing a bit of an uptick. But time will tell. Maybe this is a blip that will come down. Maybe this is something that continues to go up. We're going to keep an eye on this, and I know that the health department's watching our statistics as I provide those as frequently as I can in helping to determine whether there are any other public health measures that need to be brought into play. Now, at the opening of the program, I mentioned that there is a national concern about an uptick in cases. Mm-hmm. And there certainly could be an element, and probably is in some locations, of maybe not just reopening, but people not taking good care of themselves and using masking and distancing, et cetera. But there is an increase in cases. Now, one thing I would note, Eric, is that there is probably also a component of just increased testing. We know that when we go out and test more, we're going to discover more low symptom or asymptomatic cases. And what I noticed as I look at we mentioned that there are 20-some states that have increasing rates of case identification. But the 4 biggest are California, Florida, Texas, and Arizona. Those 4 contribute about half. Right now, they've been contributing about half of the daily growth rate in the entire U.S. And what I notice when I look at their individual states' data is that they actually have a low case fatality rate. All of them have very low case fatality rates, under 3% or around 3%. That compares to, say, in Indiana, where we've got a case fatality rate still about 5.6, 5.7%, and the U.S. average is about 5.6%. In addition to that, those states tend to actually test at a higher per capita rate than most other states. And so that, to me, says that the possibility is that they have expanded testing enough. They're also pretty populous states. They've expanded testing enough to identify a lot of low or asymptomatic cases that are causing their daily cases to go up. The real indicator of the issue, I think, is in indicators of severity, how many hospitalizations there are, how many deaths there are. And those are really the statistics that need to be looked at more closely rather than just the cases that are reported because of testing. And they actually all have declining rates of hospitalization and deaths still. But I would note that some of the severity indicators are lagging indicators. So when you have cases, it can take a while for the severity to show up. So we need to kind of keep an eye on things. Unfortunately, in Indiana and Ohio both, the hospitalizations and the deaths continue to decline. That's the most important indicator that we're still reasonably on track. Some people have noted that yesterday, I think it was, Indiana had a big spike in case reports, but they have a footnote on the webpage that says that they actually brought a new testing center online with their electronic system and added a big bolus of cases all at once as a result.
Okay, we're going to keep an eye on that, obviously, as people continue to go out. We'll keep an eye next week again on what you're seeing in the hospital as far as ventilator use. Obviously, we'll keep hearing from superintendents and other doctors as things come up. So, gentlemen, thank you very much for spending your time. Dr. David Jetmore, Wayne County Health Officer, thank you. Enjoy
Thank
your
you,
motorcycle. Dr. Thomas Huth, who you can also see Wednesday evenings, 5 p.m., WHIO-TV, their medical expert. I want to remind you, free COVID testing is still available Monday through Friday, 8 a.m. to 8 p.m. That's at the old Elder Bierman building. LHI.care/COVID testing. Richmond Farmers Market also continues, and if you are concerned you're in a high-risk area and you don't want to go there, you can still shop online for the Farmers Market. Definitely try to check that out. And also, registration is going on for Cope Environmental Summer Adventure Program, which is another way for me to plug next week's In Focus program, which will have Stephanie McCurdy from Cope Environmental as our guest. Thanks for watching this week's Ask the Doctors. Have a great weekend. Happy Father's Day. I wish you well.